Ashton Scruggs, and I will be presenting my project over healthcare management's role in maintaining retention for healthcare systems around the world. And so basically, I wanted to do this project because you do see a lot of burnout with nurses, physicians, other healthcare professions, because they are forced to work a long hour period. And I just want to get to the bottom of what's going on with retention in the healthcare. And so I created this cycle that from my research that I found to be helpful to kind of understand retention and how it coincides with other factors and definitions and concepts within the healthcare field. So basically, whenever you improve work conditions such as your wage or your flexibility in your healthcare schedule, you can then increase job satisfaction. And everybody wants to have an increase in job satisfaction, basically just being happy with your job and what you're doing. So from there, then you can improve retention. Retention is basically just your employees staying there in the company internally and really liking what they do. And then, so if you improve retention, you can reduce turnover rates and costs. Turnover is basically the cycle of firing or someone quitting and then having to replace them, which can be a confusing and long process, as you will see as we go through. So what is retention? Once you have them, you need to keep them. And that's talking about your employees in the healthcare field. You don't want to just hire someone to hire someone. You want them to be of quality and someone who will stay within that company for a while. And it's not just really keeping them in that position, it's keeping them happy and satisfied with their job. It's actually, retention is a key strategy for 90% of the hospitals, and they work to achieve this retention because it eliminates turnover, which we'll talk about in a second. So turnover is basically the opposite of retention. It's not good because it means your organization is not on the same page, and it's concerning because it's deteriorating those goals of your organization, and it's not going with your overarching mission that has been determined by your healthcare facility. It also costs millions of dollars each year, some hospitals up to $10 million. And it's also said that half of healthcare recruiters in the U.S. rank employee turnover as their top staffing concern, which means that's pretty important because keeping retention keeps a good word on the street about your healthcare system as well. So then we just go into turnover, and that's based off of retention. Turnover in hospitals is at a high cost. It's actually about 2% of the yearly spending, and sometimes up to $10 million or more for each hospital. And that's concerning the hiring and training, which is basically what turnover is. Also, turnover can create some defeating of the morale within a team and a whole organization whenever you encounter turnover. It disrupts the structure, and there's repetitive training obligations. You have to keep training, and then that creates tension within your employees who have been there for a long time, training those newbies or the newcomers. And so also it can then create defense mechanisms within those employees that are staying there because they're bitter about terminations and things like that and how they've had to train a lot. And turnover also affects not only the company and the management having to train and find hires with the HR department, but it does affect the co-workers who have to keep up with the team because they have to compensate for the work. It's being spread out, spread pretty thin between all of their team because they are missing members. And so that also creates some tension within the team. And it also leads to a decreased quality of patient care and delivery. And nobody wants that because then once your patient care and your patient delivery go down, and then it's going to make your employees frustrated because their patients aren't happy, and then it'll go down that cycle of retention. Retention will go down, and then turnover will go up, which is bad. So next, we have what do managers have to do with retention? So it is a concept within the healthcare field, but what exactly do managers, how are they involved in this process? Basically, they have a lot to do with it. They shape retention. What they want to do is they want to hire the good fit. You don't want to just hire what's convenient for you and what's a quick, easy solution to someone who's been terminated or has quit. A lot of times, managers are even measured, and their progress report is based off of who they hire, their performance, their productivity, and the patient satisfaction from that hire. And you don't want to promote those who are not good leaders. And this is for the manager to note, because if you don't if you promote someone who's not a good leader, then they're less likely to be committed to the team and less likely to be a mentor for that team. Also, the second point, managers want to push for impactful talent management funding. And so that means just putting money and effort into the hiring of someone who has talent, which is called talent management, which is, we will cover that in a little bit. And then third, they want to emphasize the organization's reputation in recruiting. Basically, this is just saying they want to appeal, it's more of the marketing side of the whole thing. They want to appeal to the limited talent pool so they can get the best pick of the litter, basically, whenever they do recruit. The fourth point is about recognizing and owning a few key goals at a time. Whenever you have a lot of concepts, it can be very confusing for the team and the recruiters. So it would be best to focus on small things that everybody can look at in a small spectrum, and then you can expand based off that. If patient satisfaction surveys are down, your focus shifts. If costs get out of hand, your focus shifts. The focus of recruiters mirrors the changing focus of the organization as a whole. So in the end, management affects the focus, and if the focus is simple, then the recruiters can communicate better with the management team. So then also, managers are a huge part in retention because they are the motivators of the team, and they keep everybody going in the morale. They act as a mediator also between the hierarchical members and their employees. And so basically, they work with HR, and then they work with their employees, and they're back and forth. And so they're definitely like a middleman that keeps everybody going. Also, management experiences a test in balancing budget with patient and employee satisfaction. This is a big factor because you have this one side that you want to, make a lot of budget costs so that your organization can have more money. But you don't want to make budget costs in the wrong thing, such as training, because if your employees aren't trained, then the patients aren't satisfied, then retention drops, and then turnover increases. So from here, what exactly causes a decrease in retention? Most distress in healthcare employees is due to actions management takes or does not take, and it's even things that they could fix. So a lot of these things are simple fixes, some of them are a little more difficult, but a few of these could be a high workload with insufficient staff. So a lot of times you hear about nurses having few nurses, a lot of patients, and that can really spread them thin and even decrease their health because they're working long hours. Also, poor staff relationships within the employees. If they're not working well together, then they're not happy in their job, and then they'll quit, or they'll be fired, so that decreases retention. Also, poor leadership and management style. Whenever you have a poor manager or a poor leader, it doesn't make you want to come to work. I've experienced both, a good manager and a poor manager, and a good manager makes you want to come to work and happy to be there every day. So that's definitely a part of increasing retention. Also, lack of effort in the sense of rewards and recognitions. Everybody wants to be recognized for doing a good job, and it's just nice to hear that you're doing the right thing and just hear that encouragement that you're doing well. Also to know, sometimes administrators focus on the budget in isolation without recognizing the downstream effects of cost cutting on delivery of quantity healthcare services. So basically, they just want to cut costs, but they don't realize the domino effect it could have on their employees, their patient, and then affecting retention. So how exactly do we improve retention? Well, the obvious answer and the number one answer is decrease turnover. So when you decrease turnover, looking back at that cycle, that means you want to increase job satisfaction. So creating that competitive salary, vacation time and personal time, providing that for your employees. Retirement savings is big. It seems like the retirement age is always rising. So being able to save for that is always good. Treating every employee with respect, that's just kind of a given in your in the healthcare field and in any field whenever you're dealing with your employees. And then recognition and rewards, as I just mentioned, that's a big thing. And also career development. You always want to be able to go the next step in your career and move that next step up. And even if you don't want to, you can always do things to work towards that career development, maybe improving your skills and other education programs. And so, the more it's said that the more service a hospital can provide to employees, the more retention and positive morale become established in the healthcare culture. And so, another way to improve retention is teamwork. And all of these points might seem obvious, but whenever you look at the healthcare field and the research and the articles that have been done, this is a big thing. So basically, you would think two-way communication would be easy, but sometimes it's not. So two-way communication encourages feedback and teamwork, and then also decision making. Decision making is a huge thing because if the employee doesn't feel like they have a say in what they're doing and where their career is going, that could really deteriorate their motivation. Also, developing high commitment. Whenever you have a teamwork, you want to work together and you commit to that project that you're all doing together, working for that patient. Healthcare is all about teamwork. And also, it's important to have clear job expectations for that manager to set the ambiguity down and make everything clear. And it also sustains long-term relationships. When things are clear, you're more trusting of that person, and especially that ties in the two-way communication as well. So those who engage will be in teamwork, will be open to innovation and sustain a positive group morale, which facilitates commitment and loyalty throughout. And ultimately, if there's trust, the employee is less likely to quit, which means retention would go up, turnover would go down, which is good. And then another way to improve retention is the social exchange theory. I'm sure we've all heard of this in our psychology classes and healthcare classes as well. And just a quick review, it meets professional workers' behavioral expectations and influences the retention in a positive light. And this is more specific to the retention concept. And basically, the main reason a professional worker leaves their current organization is the failure of the employment relationship with that manager. So to fill this gap, we should engage in the social exchange theory. The first point is guidance and advice from the supervisor, creating a harmonious relationship between the employer and employees. That's just kind of obvious, it just goes with having that good manager versus the bad manager. Also, fairness, trust, teamwork, promoting a meaningful work environment is very important to improve retention. And then another way to improve retention is mindfulness, which a lot of people wouldn't think about this, and they kind of like to put it on the back burner, but it's actually very important because mental health, as a lot of people know, is very prevalent these days. So mindfulness is just basically self-care, and within self-care, that's work-life balances. So basically balancing your work and your home life, so you really need to implement exercising, eating good, have that social network that you can rely on, and then also a spiritual technique if you so choose. And then an employee wellness program is another big step of mindfulness. And so this is anything from like health screenings at your work, staff retreats, going away somewhere, taking a field trip or something. And then there's also this thing that I found called snack and relax, and a lot of teams will just have a little power hour where they snack at lunch, or they bring snacks for everyone and things like that. Of course, healthy because it's the healthcare field, and where they just debrief about the week and kind of talk about things and maybe tips that they could help other people in situations that they've encountered. Also, the third of mindfulness is continuing medical education programs. It's always important as technology and things are improving every single day, it seems like, to really keep up with that education. And it doesn't even involve like your specific job. It could also involve your education of that mindfulness and of how to stay healthy within your job. So this could be increasing the awareness and to provide tools to address demands that are associated with caregiving in your specific job and the heavy load you might encounter. And so, why mindfulness programs? Why are these important? Well, it decreases the risk of early burnout. And so, what I talked about earlier, that heavy workload, whenever you take time for yourself to kind of debrief and relax, it'll decrease your risk at being burnt out. Early intervention and prevention is key too. If you catch your early burnout and you catch it early, it'll be easier to conquer and take on, and then hopefully that burnout will go away. Also, mental health is a huge issue, not only in the US, but around the world. So mindfulness is very important within the healthcare field, especially with maintaining that retention. Also, a lot of people have been studying age dispersion. Does retention decrease with age, or is it the lowest whenever you're first taking this job? And really, it can happen to anybody of any age. It affects all age groups. And so the medical school, there was some research on that. Obviously medical school is so hard. We're all in college and we know how hard school is. And then medical school, graduate school, anything like that is extremely hard. And it starts early. And so it shows a higher prevalence rates of physiological distress, causing feelings of incompetence, a lot of depression, anxiety, when you have to know all these terms as a resident in the medical field, things like that. And you just are pushed for implementing some health programs. There's push right now for it to be taught in nursing and medical school. And that way the students can realize there is an outlet and to prevent that burnout and to keep that retention within their job eventually. Also, for another age group in the active medical duty, it seems to be that group self-care works the best in maintaining retention, just because it's nice to talk to someone who might be feeling the same way or to relate to someone. And then also the geological dispersion of retention. It's happening all around the world. It's not just the US or one country or the other. All of my articles that I've done research on have been pulled from several countries, as you see below. So, the future of retention studies. What are we going to expect in the future? Is retention going to rise? Is it going to drop? We don't know, but one main key is to focus on, it's called talent management, which is kind of a new term for retention and a strategy to help retention. As you see below, talent management is a way to figure out how to capitalize employees' competencies and prepare strategies to encourage their employees to take pivotal positions, contributing to the organizational success. So basically it means seeking out those employees and kind of mentoring them to increase their talents or to work harder or to kind of see that talent in them and help them grow it and be their mentor, and then encourage them to apply for those positions, those leadership positions within the healthcare field. And so basically it's just helping the future of the healthcare facility. And surprisingly, a lot of most healthcare organizations don't have a plan in place for this. They kind of have dabbled in it, and they are able to identify which positions within their healthcare field are pivotal and the head positions. They have the tools, but they call them a motivation system. Basically, it's just meaning they concentrate on a specific group to help grow them to be leaders of the facility in the future. And so because they aren't aware of talent management, they're more focused on the positions rather than the talents, which is a big thing. You want to be focused on the talents and then put them in a position rather than be focused on filling this position and who are you going to fill it with, and then you just might fill it with someone random. You want to focus on those people with the talent, and then that will decrease retention. So below are my references. And then I will go back to the retention cycle just so you can look at it one more time and review, see that improving those working conditions such as wages and your mindfulness, your healthy nutrition can lead to an increased job satisfaction. And when you're happy with your job, it improves retention. People want to stay in their job at their healthcare facility. And then that in turn reduces turnover rates and costs within the facility.